Hello, thank you for joining me today to go through our talk today on Medical Classics Doctrine. Again, this is one of a lecture of the entire course on the overview of TCM classics and doctrines. Today we're going to look at Medical Classic Doctrine, or we call it 医经学派. The doctrine really have two definitions. The very first one is the narrower definition. It's the exclusive study, elaboration, and understanding of the classical text, Huang Di Nei Jing, or commonly known as the Yellow Emperor's Canon of Medicine. And if we look at the historical documentation at that time, there's a very famous historical book. It's called Han Su, or what we call the Book of Han, or Book of Han Dynasty, which is a book of history that documents activities of half of the dynasty. We have the West Han Dynasty, and then we have the East Han Dynasty. So this book documents the West Han Dynasty from 206 BC to about 23 AD. It's stated, and this is a very good historical documentation book because it was quite accurate and it really it's probably the only book around that time that document Han Dynasty and also pre-Han Dynasty activities. So it really helped us to really understand the lives of the Chinese people around that time. It stated that there was 7 medical classics in existence at that time. And these are, Huang Di Nei Jing is one of them, the Yellow Emperor's internal classic. Then the Yellow Emperor's external classic, we call the Huang Di Wai Jing. And Bian Cue Nei Jing, that's Dr. Bian Cue's internal classics. And Bian Cue Wai Jing, the Dr. Bian Cue's external classics. And then we have Bai Si Nei Jing, Bai Si Wai Jing, which is Dr. Bai's internal classics and external classics, as well as Dr. Bai's what we call a Bai Si Pang Bian, which is Dr. Bai's supplement. You can see this is 7 very well-known textbooks in TCM, except unfortunately through famine, through war, and of course at that time, all these books are not on paper. They are all basically passed down, carved on bamboo sheath or animal bones. So therefore, losing them was a very easy thing to do. So the only thing that really passed down was Huang Di Nei Jing. So in a narrow definition of this doctrine is everything the study of Huang Di Nei Jing is the medical classics doctrine. Now, there is a broader doctrine definition, is the study of publications, theories, principles that elaborate and elucidate and clarify or based upon Huang Di Nei Jing around the Warring State era, around the Qing dynasty, around the Han dynasty, 3 kingdoms and Jin dynasty. So there's quite a few classics around that time that was not lost, but they are based on the Yellow Emperor's canon, and they are becoming what we call the Bibles of different areas of TCM. So, for example, Nei Jing is written approximately around the Warring States era, which is somewhere around 475 BC, around that time. And then the next classic that you will see is Xianghan Zha Bing Run, which and also Zhong Zan Jing, which both of them are in about Han Dynasty. They're written in Han Dynasty. And then the next is the Mai Jing, which is the post classic, as well as Jia Jing, which is the Acupuncture classic, was written somewhere just right before 420 AD. So in this span of 1,000 years, quite a few classics really pave the foundations of TCM, or traditional Chinese medicine. And so these are what we call classics that elaborate upon the foundation of the Yellow Emperor classics. So we consider them are also classics that you must study. So in a more broader sense, the studying the medical classic doctrine, it's also to study these classics as well. So again, there's actually a lot of supporting publications. There's a vast amount of it, but most of them are lost. And the main ones that we see still with us today is, for example, Nan Jing, Classics of Difficulties, Sanghan Zabing Run, which is discussion of injury by coal, and Zhong Zang Jing, which is a classics of Zhang Hu, and Jia Yi Jing, which is a classics of acupuncture, and Mai Jing, classics of pulse. So a lot of all these books are considered to be part of this classics doctrine, except that the Shanghan Run is such a major book, and it takes lifetime to study. So later on, in our next doctrine, we're going to basically studying about Shanghan doctrine, what that is all about, and how even to today it is so useful in our modern context in the treatment of diseases. There are many supporting actors, many supporting doctors and authors that has written regarding to Huang Di Nei Jing and its work. For example, people like Dr. Wang Bin, people like Dr. Wu Kun, Ma Si, as well as Zhang Zicong, for example. So these are just some of the supporting cast of this doctrine. Now, Huang Di Nei Jing by itself, there are various translations into many different languages. And today we're just looking at the English portion. And if you look at the translation into an English name, there is the Yellow Emperor's Inner Classic, there is the Inner Canon of Huang Di, there is the Yellow Emperor's Inner Canon, there is the Huang Di Classic of Internal Medicine, there's Yellow Emperor's Canon of Traditional Chinese Medicine. So there's a lot of names that's used for this particular text, classic. So a lot of times through this lecture, I'll just call the Nei Jing or Huang Di Nei Jing, then you know that this is this particular book. Now, if we dissected the name Huang Di Nei Jing, Huang means yellow, Di means emperor. So yellow emperor is Huang Di. Nei means inner or internal, and Jing means classic or scripture. And so a lot of time people just call it the Yellow Emperor's Inner Classic. The reality is that the inner is a opposite context to outer or external. So a lot of time is not necessarily a study of just the inner body. That's not what it means. It just means it's a primary text of Huang Di's work. So you could say the Nei Jing is a primary text, and then Wai Jing is a secondary text, okay? And Pang Bian is kind of like a supplement. So that's the way the Chinese should be translated in this situation. So let's move on and talk about Huang Di Nei Jing more. Again, this was published around the Warring State period. The exact time we are not so sure, but the Warring State period is about 475 BC to about 221 BC. And the reality is that if it's written by this time, Yellow Emperor is already long gone. Obviously, it's not written by him. And if you look at a lot of Chinese literature, a lot of publications, it's not just in medicine, in astronomy, in different things, literature. A lot of people love to just put the Yellow Emperor's classics of something. And the reason they put that is because it sells. I mean, it's got name brand recognition. Since that the Chinese people consider themselves as the offspring of the Yellow Emperor, so anything that's got Yellow Emperor on it, they want to read it. So I think in some ways it just kind of share the importance of that text. And interesting enough, this Yellow Emperor's classic, it's a wonderful, well-written book. It's almost a compilation of all the basic TCM theories and foundations are all in this book. This book is divided into two sections, Su Wen, or what we call the plain or simple questions, and Lin Su, the divine pivot or spiritual pivot. And so it's about 81 chapters each. 162 chapters total out of these two sections. And this is really, really the earliest comprehensive documentation of medical knowledge, experience, and history in the Chinese history. So this is a very important text, not just for medicine, for practitioners, but also for historians who are studying of Chinese culture. Now, if you look at the next slide, I would have a map here to show you during that time of a warring state. And in the map, you will see there's many different colors of different sections. And you'll see it is truly warring states because there are many different little countries in China around that time. And they are all kind of fighting each other. So this is a period of time of much chaos, period of time of much competition, and obviously also a period of time of incredible flourishing of philosophy, flourishing of political science, as well as management of country, warfare, etc. A lot of the important work that creates the fundamental foundation of Chinese culture really began this warring states era. How ironic, a lot of stuff is so much produced and created during wartime. And Huang Di Nei Jing does have a very strong impact because later on, all the different school of thoughts, all the different doctrines, all the classics, all the books and publication that's written really originates from the fundamentals of this book, the Yellow Emperor's internal classic, the Huang Di Nei Jing. Therefore, Nei Jing, Huang Di Nei Jing is considered to be the Bible of TCM. Now, Huang Di Nei Jing has also many other classics. There are many other classics, but they all originate and relates intimately to Huang Di Nei Jing. For example, the classics of difficulties, which is an elaboration of the fundamentals. It's written in a Q&A form, which we'll look at a little bit later. Shanghan Run, which talks about injury by cold, and it's an elaboration of febrile diseases that's caused by infection of cold pathogens, described in the Huang Di Nei Jing. Jing Gui Yao Lue, for example, it's a first really strong formula book. It's our essential strategies for the Golden Cabinet. It discusses treatments of internal medicine and miscellaneous diseases, what we call non-infectious diseases. And again, its understanding, its theoretical format and theoretical foundation comes directly from Di Nei Jing. Zhenjiu Jiayi Jing, or what we call Jiayi Jing, again, is a study of acupuncture, is the first comprehensive acupuncture Bible, elaborated again from Nan Jing. Mai Jing, the post-classical, the classical post, is the study of diagnosis originated again from the theoretical foundation of Nan Jing. So these other classics, very important in creating foundation in the different areas of TCM, are all started out from this fundamental help and support from the Huang Di Nei Jing. Now, if we look at some of the mythology and we look at some of the history, Huang Di, the Yellow Emperor, is a wise leader. This is around 4,000 to 5,000 years ago now. And he's considered to be the originator of the Chinese culture and well revered and received and respected in the history of Chinese history and by its people. And this is a time of what we call a shell bone era. I mean, all the stuff, all the documentation are carved on the cave, on the wall of the cave, as well as the bones of the animal. And it's most likely that it's not possible that this book is written by him at that time. Now, this book is approximately 144,389 words, and it's a very well-written, profound book. And so to use Huang Di in its title, it's to really denote its incredible importance, and which is important, and also in some ways preventing burning of a book. Later on, emperor, in the Qin dynasty, for example, Qin dynasty wants to burn all the books. But if you have the Yellow Emperor's classics or Yellow Emperor's name on it, he doesn't dare to burn a book because, oh, I see, this is from the Yellow Emperor's writings, so therefore he's not going to touch it. So in some ways, trying to preserve the book later on for people to be able to read. During the time environment where the Huang Di Nei Jing was written, there are at least 20 different books that have Huang Di in its title at that time, but mostly are lost. Now, during the Warring States, why this is an important time? Because this is when sufficient medical experience and knowledge start to congeal. They're starting to collect together. There are social changes. There's actually scientific changes, war, and even the beginning of anatomy. And there's also, this is a time, slowly, the decline of witchcraft. So as we say, medicine is becoming more systemized during this period of time. And the reason why we study Huang Di Nei Jing is that it provides the theoretical foundation of TCM for any avid students of TCM. You really want to go to the source and study the source, because it's also, besides giving that theoretical foundation, it provides the proper methodology and frame of work of TCM development and thought process. And there are really three main contents in this book. First is the theories of yin and yang and 5 elements, and it relates to the body and the world. Second is the holistic perspective on health and disease. Huang Di Nei Jing is really an incredible book about holism. It's about how things relate to each other, how different parts of the universe, how different parts of our inner body relates to each other, but also how our body relates to the cosmos, relates to the universe, how our body is connected to the world that we live in. And this holistic perspective, it is written throughout the entire book. You turn on every corner, it's all about a holistic perspective. And then not the least, the differentiation, the diagnosis of different diseases, as well as its treatment, methodology, and therapies. And if we break it down into more detailed content, we are looking at Yangsen. So we'll be seeing some situation where they're talking about how you can have a long life without diseases. Talk about how prevention of diseases is very, very important. More important than just treating the disease itself. So even talk about how a superior physician is the person who treats what has not diseased yet. The average physician is the one who treats what's diseased. And an inferior physician, forget it, we won't even talk about that. Okay? So it also talks about Zhanghu theory and the channel theories, diagnostics, disease discussion that goes into etiology, pathology, disease progression, and the formation of syndromes. It talks about therapies such as acupuncture, moxibustion, tuina, and etc., cupping, etc. It also talks about climatology, how the climate, the weathers of where you live can really affect a human's health. Not the least, of course, the yin-yang theories that permeate through all the different aspects of Chinese culture, the 5 elements that permeate through any kind of study of science in the Chinese culture. And in disease discussion, it talks about 19 different etiologies. It talks about qi and blood etiopathology. It talks about Zhanghu pathology. We also talk about the 6 qi pathology. It talks about the 8 principle, the yin-yang, 表里, 寒的, 虚实, yin and yang, external, internal, cold and heat, deficiency and excess dimensions. It also established, this of course is established later on the 8 principles, also the 8 principle syndrome differentiation. It established the 6-channel differentiation. It provides the foundation to be established of Wei Qi Yin Xue, 4 stages of differentiation in Wen Bin later, as well as Qi and blood differentiation and Zhanghu differentiation. It also discussed specific topics on fever, malaria, cough, pain, atrophy, spasm, swelling, and other diseases. So it's a pretty robust medical textbook that's written quite well, and that has a lot of information. Now, there are some main characteristics of Nei Jing I'd like to share with you. For example, this book opposes witchcraft. It does not believe in witchcraft that give fake therapies and trying to get someone better without any kind of medicinal intervention. Number two, it has a very strong holistic perspective, and it believes that human is a holistic organism that's connected to the universe. It also talks about the constant movement and change of the universe. It's no different than in our body. Our body doesn't matter if we're sitting still, standing still, or sleeping. Our body is still in constant movement and change, regardless of time. And you also talk about the difference between pathogens and anti-pathogenic forces and how that conflict creates a balance in the universe. And not at least, when you're sick, that's when your yin and yang is out of balance. Therefore, this book talks a lot about what is the meaning of yin and yang balance. So, if we can break it down a little bit more, Huang Di Nei Jing, the very first section, is Wen The Plain Questions, or what we call the simple questions. 81 chapters. And these 81 chapters focused on the fundamentals of Zanghu, diagnosis, Etiopathology, treatment principle. And the secondary focus is on Jinluo, on the channel and collateral theories, point studies, and needling methods and techniques. Now, if you go to Ling Su, is sometimes we call the divine pivot, spiritual pivot, or divine core. 81 chapters focuses on mostly channel theories, meridians, point study, and needling treatment. So you can see that acupuncture is really a very big area and big topic, even in the ancient times already. It occupies literally more than 50% of the Huang Di Nei Jing. Now, later on, as time moves forward, there are three main contributions to the Nei Jing in basically three distinct ways. The very first, since Huang Di Nei Jing was written in a very ancient time, and the language are quite different than later on time, therefore it needs to be somewhat translated or compiled. And sometimes the words are missing. Sometimes the word need to be edited because in the old days of bamboo sheath, and they have to eventually go into printing press in the Song Dynasty. So there are three ways that Nei Jing has really developed. One is a direct compilation of Nei Jing. Second is direct translation and elucidation. There's some people who would actually take the Nei Jing and talk about and write about what they believe, what Nei Jing is trying to tell you, and it elaborates upon some of the theories of Huang Di Nei Jing. And then the third is actually the expansion on special topics. You would take a topic and expand upon that to a great way. So you can see Huang Di Nei Jing really paved the foundation for later development of all the different doctrines, earth school of thoughts, even advanced theories and treatment and principles and therapies of all the TCM later on to follow. So let's look at direct compilation. Again, this is the preservation of original language in the book. And there's at least 4 authors that spend their lifetime to really make that happen. And Dr. Wang Bing is one of the main ones, Dr. Wu Kun, as well as Dr. Ma Si and Zhang Zicong. These are the 4 people that I talked about earlier. And the direct translation and elucidation in the second way, you have also several other very, very famous physicians in their own right in really expanding and translating, elucidate, and help us to have a better understanding of Huang Di Nei Jing. These are Yang San. He is the complete follower of Nei Jing. He believes that Nei Jing is undisputed the Bible of TCM. Zhang Jiebin also as well. Later on, Zhang Jiebin is in the Ming Dynasty time, and he is really one of the major pillar of the Ming Men doctrine. And he talked about how Huang Di Nei Jing was super important, and a lot of his writing is basically a direct elaboration of the Huang Di Nei Jing. And these are the 2 very, very complete followers of the Huang Di Nei Jing. Then there are people that criticize, or shall we say, look at Huang Di Nei Jing and say, hey, there are actually some mistake in there, or maybe that this is incomplete. Let's see if I can complete and make it better. And there are 4 critical editors, or we call it, Dr. Hua Shou, Dr. Li Zhongzi, Dr. Wang An, and Dr. Shen Youpen, for example. Those 4 major authors that really take Huang Di Nei Jing, tease it apart a little bit, and trying to instill and infuse their own understanding, criticizing some of the passages of the Huang Di Nei Jing. Then the third contribution is expansion by special topics. These are, some of them are actually classics in their own right. For example, Qin Yuelen, which is commonly known as Bianque, is known to be the author of the classics of difficulties. That's an amazing text that further elaborate upon the foundations of TCM theories. And then Zhang Zongjing, I think by now you know that he is the father of TCM, and basically he is the writer and contributor to the Xianghan Zabing Run. Hua Tuo is another doctor that wrote Zhongzan Jing, and Huang Fumi, basically he's acupuncture. He written the acupuncture Bible, the Jiayi Jing. Liu Wansu, basically he is the initiator of the 5 heat pathology doctrine, which we will talk about in another course, in another class. And then not the least, Dr. Luo Longji, Dr. Liu Yude, Dr. Zhu Nian, and Dr. Chen Wujiu. These are some of the doctors that written about the formulations that expanded upon Nei Jing's foundation. So these are special topics that expands upon the theories and of Nei Jing. So let's look at Nan Jing for a moment. Nan Jing is written by Bianque. We call it Qin Yuelen. And Sanghan Run, as we said earlier, was developed by Zhang Zongjing, elaborate on the cold pathology and treatment. And Huang Pumi focused on the treatment of acupuncture and moxibustion in his seminal book of Zhenjiu Jiayi Jing. And now that these Zhongcan Jing, it's basically talk about it's what we call a classics of central visceras. Basically, it's a book on Zhanghu, is elaborations of on Zhanghu, basically. And now that these Liu Wansu written this wonderful book called Su Wen Xuanji Yuan Bin Si. It's the name of the book is called The Standards of the Mysterious Inner Workings of the Origins of Disease. He elaborated strongly on etiology, etiopathology, especially in the area of heat pathology, and he's an avid expander of the Huang Di Nei Jing concept. So let's take a look at Huang Di Nei Jing itself. We look through some of the topics and the critical theoretical foundation Huang Di Nei Jing has provided us. First, Huang Di said about yin and yang that the law of yin and yang is the natural order of the universe, the foundation of all things, mother of all changes, the root of life and death. In healing, one must grasp the root of the disharmony, which is always subject to the laws of yin and yang. So right off the bat, in this situation, what it's already telling you is giving you a definition of what disease is all about. Disease is an imbalance of yin and yang. When yin and yang is no longer in balance, that's when we get sick. Okay, and no difference in the world, in the universe. Disease of the universe, imbalance of the climate, imbalance of the weather, situation that creates in the universe, it's also an imbalance of yin and yang. That's the law of yin and yang. Then we go to the 5 elements. And he says in chapter 23 of the Nei Jing Su Wen, says that each of the 5 zang organs also have its aversions. Each organ is like a little person. It has its own liking and dislikes. The heart, for example, doesn't like heat. The lung, for example, doesn't like dryness. The liver, for example, hates wind and movements of air. The spleen, for example, hates dampness. Kidneys, it hates dryness, for example. That's in chapter 23, talk about the 5 elemental principle. Basically, if you look at this, you start to recognize is that elements, it's telling you that there are distinct characteristics of all the different matters of life. And all the different matters of life are constituted and consisted by some variations of these 5 elements. Okay, so studying the 5 elements can help us to appreciate the quality, the progression of the kind of disease that we are dealing with, so that we can give proper formulas, proper treatments that can actually bring that elemental balance back, bring that yin and yang balance back in the 5 elements. So in Zhang Hu, in one of the chapters, you talk about how Qi answered in Zhang Hu. In general, the reproductive physiology of a woman is such that 7 years of age, her kidney energy becomes full, her permanent teeth comes in, and her hair grows long. Now we're talking about reproductive endocrinology now. Now you talk about the span of time that we are reproductive and also the aging process. And this is and some of a lot of different areas in the Su Wen is written in kind of like a question and answer kind of thing, or what we should say it's a dialogue between the Yellow Emperor and its court physician, for example, Qi Bo. And continue onward in this reproductive endocrinology of women, at 14th of age, the Tiankui, or the fertility essence, matures. The Ren, which is a conception channel, and the Cong, the vital channels, responsible for conception, opens up. Menstruation begins and conception is possible. Now this is at 14 years old. And this is written, and this is a good solid, 3,000-4,000 years ago. As you can see, this is your menarche when the women start their period. So you can see that hasn't changed too much through time. Today the average age is 13 point something. In the old days, 14 years old, as you can see. So it's pretty accurate. Continue onward at age 21, the kidney energy is strong and healthy. The wisdom teeth appear, and the body is vital and flourishing. So we talk about how the growth development of 21 years old. And when you get to age 28, the bones and the tendons are well developed by this point, and the hair and the secondary sex characteristics are complete. This is the height of a female development. So frequently this is a time where we say that basically you are around the peak of your reproductive function. So if you look at today, on the average, if you're a healthy woman, your peak reproductive function is before 30 years old, somewhere between 25 years old. Somewhere the peaks around 25 years old. In the TCM in Yellow's Emperor, talk about 28 years old, is a few years behind. Now, at 35 years old, the yang min channels that governs the major facial muscles begin to deplete. This is 35 now. The muscles begin to atrophy. You start to having facial wrinkles appear, and the hair begin to thin. So a 35-year-old, it's already showing some of the aging qualities, even though they might be minute, but it's already showing during that time. And at age 42, all the 3 yang channels are exhausted. The entire face starts to get wrinkled, and the hair begins to turn gray. And so that is a time where the yang min channel truly becomes weakened, but it's not just the yang min channel, all the 3 yang channels start to deplete. Now, when you get to 7-7, which gives us 49 years old, this is a time of menopause. And this is a time where Ren and Cong channel are completely empty. And the Tiankui has dried up. The fertility essence has dried up. and the menstruation ceases, ovulation ceases, and no longer able to conceive. So 49-year-old menopause age, if you look at today in the United States, we're talking about somewhere between 50 to 51. So you can see that hasn't changed too much, and that still stays true today. If you look at men, in male, we are governed by the A times A cycle. Like female is a 7-year cycles, male is more of an 8-year cycle. So in male, at 8 years old of age, our kidney energy becomes full. The permanent teeth appear, and the hair becomes long, just like a girl at age 7. At 16 years of age, the kidney energy becomes ample. The tiankui is mature, and the gene is ripe, so procreation is possible. This is when men can actually start to get a woman pregnant. They can ejaculate, they have strong erections, and they're able to procreate. And at age 24, 3 times 8, for example, the kidney qi is abundant, the bones are strong, tendons grow strong, and the wisdom teeth comes in. This is when a man is at its kind of like, it's almost coming up, not at a prime yet, but coming closer to the prime time. In age 32nd, 4 times A, 4A is 32 years old. The body is at a peak of strength, and the function of the male are at its height. Now, at age, let me see, what we got here is 4A is 32, and then 5A is 40 years old. At 40 years old, the kidney qi begins to wane, and the teeth becomes loose, and the hair starts to fall. That's the aging aspects of a male. And at age 48, the young energy of the head begins to deplete. The face droops, becomes sallow, the hair grays, and the teeth deteriorates. And then at the 56 years old, the liver energy weakens and causing the tendons to stiff. So at 56-year-old, this is a time when men become much, much stiffer with their spine. This is 7 times A. And now, not the least, A times A give us a complete cycle in the man's reproductive endocrinology. It's at 64 years old, the tiankui dries up, and the gene is drained, resulting in kidney exhaustion, fatigue, and weakness. This is also a time where a lot of men start to lose their erections, so they no longer can procreate. Not only that, their procreation is weak, the sperm is weak. So at the time, if they're able to procreate, a lot of times the essence, the DNA from your sperm is not as strong, so you can actually create a lot of abnormal genetic issues during this time. So when if you look at chapter 1 of the Universal Truth of Huang Di Nei Jing, it says that when the energy of all the organs are full, the excessive energy stores in the kidney is excreted for the purpose of conception. But now, the organs have aged, and their energy have become depleted. Therefore, the bones and the tendons have become frail and stiff, and movements are hampered. The kidney reservoir becomes empty, making the end of the power of conception. This is chapter 1 of Huang Di Nei Jing. It talks about the importance of reproduction and the importance of the preservation of species. So it does have a long view, as you can see, how that's very important, not just in the sense of health, but in the sense of producing a healthy baby, healthy offspring. And in Etiopathology, one of the chapters, Huang Di say that in nature, there are 8 types of wind. And within the body's channel and collaterals, there are 5 types of wind. What do they mean? Well, it talks about how there are different types of wind that's outside the environment. Wind, as you know, is air movement. Air going from low pressure to a high pressure area because the air rises in a high pressure, and then the air actually moves into a different pressure differential. So this is no different in our body. So Qi answers Huang Di and says, well, the 8 types of winds that occur in nature are abnormal and pathogenic winds, which can cause diseases. These can affect the body channels and collaterals, producing 5 types of different internal wind that damage its corresponding organs. And these internal winds are liver wind, wind of the heart, wind of the lung, wind of the kidney, and not the least, the wind of spleen. And they are caused by abnormal changes in the 4 seasons. So Huang Di Nei Jing spent a lot of time looking at the importance of understanding the seasonal changes. If you can understand the seasonal changes and protect yourself or anticipate the changes with whatever you can do in the sense of clothing, nutrition, storage of food, if you're able to do that well, you'll live a long period of time. Obviously, nowadays, we can literally create season. We can have an air conditioning blasting in our home and call it the winter. We can have heaters go on, and that can actually warm us in the winter time. So you can see we can actually create microclimates. But nevertheless, the universal climate still affects us. So it's still very important to appreciate and understand these 4 seasons and differences between them. And frequently, Huang Di says that whenever you get sick is actually the time of change. So between seasonal changes, these are the time where people do get sick. For example, that springtime overact on the summer. Late summer overacts on winter. Winter overacts on summer. Summer overacts on autumn. And autumn overacts on spring. This is chapter 4, the truth from the golden chamber. Basically, what he's saying is that seasons can also create problems for the next season, or season itself can also create imbalances among themselves also as well. Because sometimes, as you know, in the winter, we are supposed to be cold, but what happens when it's hot? In the summer, we are supposed to be hot. What happens when it's cold? Spring, we are supposed to just be warm. What happens when it's too hot or too cold? Fall time is supposed to be a time of harvest. What happens if it's too hot or too cold? All these can affect the changes of the environment outside of us that directly impact the environment inside of us. So let's continue to look at chapter 1, the universal truth. It says that in ancient times, the Yellow Emperor, Huang Di, was known to have been a child prodigy. As he grew, he showed himself to be sincere, wise, honest, and compassionate. Right off the back, sincere, wise, honest, and compassionate are really true characteristics that you want to admire and respect and develop as a doctor. That's what Yellow Emperor is trying to tell you right here. He became very learned and developed keen powers for observing nature. Right here again. To be a good healer, you have to have a good understanding of the nature and the environment and the climate that you live in. His people recognize him as a natural leader and choose him as their emperor. Well, if you're smart, if you understand some of these issues around the climate, around diseases, you naturally become the leader of your patients. Patients come to you for your guidance. So that's what Huang Di says here is wonderful. And if you look at how we define nature, is the phenomenon of physical world collectively. So this includes the plants that we see, the animals that zoom around underneath it, and the landscape, which is a combination of both and others, and other features and product of the earth, as opposed to humans or human creations. So nature, a lot of time, when we leave it alone, it can create its own balance. But when man and human beings interfere, sometimes we can create a mess in our nature. So it's important to sometimes allow the nature to be instead of trying to create, man-made create nature. Move on to chapter 1, again to the next passage. During his reign, Huang Di discoursed on medicine, health, lifestyle, nutrition, and Taoist cosmology with his ministers, Qibo, Lei Gong, and others. Their first discussion began with the Huang Di inquiring, I've heard that in the days of old, everybody lived 100 years old without showing the usual sign of aging. But in our time, however, all our people age prematurely, living only 50 years old. Is this due to a change in the environment, or is it because people have lost the correct way of life? As this Yao the Emperor inquires to his court ministers. Now, if you look at symptoms of aging, there's several of them. You can always have a list. For example, increased susceptibility to infection, greater risk of heat stroke and hypothermia, slight decrease in height as the bones in our spine become thinner and start losing some height, bone breaks more easily, joint changes, stoop posture, slow and limited movements, decrease in overall energy, constipation, urinary incontinence, a slight showing of thoughts, memory changes, thinking, for example, and reduced reflexes and coordination, difficulty with balance, decrease in visual acuity, diminished peripheral visions, some degrees of hair loss, wrinkles, graying hair, weight loss after age 55 in men and after age 65 in women. This can be due to loss of muscle. So in some way, these are all the symptoms of aging that we know today and also in the ancient times. So Qibo replies to Huang Di, well, in the past, people practiced the Tao, the way of life. They understood the principles of balance, of yin and yang, as represented by the transformation of the energy of the universe. Thus, they formulate practices such as Daoshing exercises that combining stretching, massaging, and breathing to promote energy flow, and meditation to help maintain and harmonize themselves with the universe. They ate a balanced diet at a balanced regular time. They rise and retire at regular hours. They avoid overstressing their body and mind and refrain from overindulgence of all kinds. They maintain the well-being of their body and mind. Thus, it is not surprising that they lived over 100 years old. So this is chapter 1. Right off the back, it talks about already prevention of aging. This is a true Taoist medicine because it's really focusing on prevention right now. It's not just focusing on treatment of what's disease, but it's trying to teach us to be the exceptional physician. So continue onward in chapter 1. So these days, people have changed their way of life. They drink wine as though it's water. They indulge excessively in destructive activity, draining their essence that is stored in your kidneys, and despite and depletes their qi. They do not know the secrets of conserving their energy and vitality. They seek emotional excitement, excitation, and momentary pleasures. People disregard the natural rhythm and order of the universe. They fail to regulate their lifestyle and diet and sleep improperly. When this happens, so it is not surprising that they look old at 50 and die soon after. So the accomplished ones of the ancient times advised people to guard themselves against 贼风. 贼风 means thievery wind, the wind that steals, disease-causing factor. So on the mental level, one should remain calm and avoid excessive desires and fantasies, recognizing that these excessive desires and fantasies can deplete your essence. and recognizing and maintaining the natural purity and clarity of the mind. When internal energy are able to circulate smoothly and freely, and the energy of the mind is not scattered, but is focused and concentrated, illness and disease can be avoided. Continue onward to the next passage, says that previous people led a calm and honest existence, detached from undue desire and ambition. They lived with an untainted conscience because they lived simply. These individuals were active but never deplete themselves. And they know contentment as reflected in their diet of basic but nourishing foods and at attires, clothing that was appropriate for the season and but not overly luxurious. Since they were happy with their position in life, they did not feel jealousy or greed. They had compassion for others and were helpful and honest, free from destructive habits and activities. They remained unshakable and unswayed by temptations, and they were able to stay centered even when adversary arise. They treat others justly, regardless of their level of intelligence or social position. In this passage, we really talk about how to live correctly. We haven't even gotten to the medicine part at all. We are already talking about lifestyle. This tells us that Huang Di Nei Jing puts tremendous amount of emphasis on prevention of diseases and lifestyle. Dietary, nutrition are so important, critical. This is your bedrock. This is your foundation. So whenever we treat a disease or somebody's sick, we do really want to look at a lifestyle. Continue onward to the next passage. Huang Di asks, when one grows old, one cannot bear children. Is this due to heredity or to the loss of one's procreative energy? Shibo answer, in general, the reproductive physiology of that 7-year cycle and an 8-year cycle, which we talked about earlier, it's in this area. So it's important to look at that chapter 1 because chapter 1 really set the tone in the directions how we can be an exceptional physician. So let's look at other classics. And today I'm just going to spend a little bit of time on Nan Jing. There are many others, but Nan Jing is something dear to my heart. Nan Jing is called a classic of difficulties. It's a Yellow Emperor's 81, or sometimes it's called a Yellow Emperor's 81 classics of difficulties, or sometimes we call it 81 difficulties. It's published during the Warring State era. The author is Bian Che. And it was originally named as, again, Huang Di 81 Nan Jing, or Yellow Emperor's 81 Classic of Difficulty. And it's written in the format of Q&A, question and answer. It provides answer to about 81 medical questions. Don't ask me why they always keep on choosing 81. 81 chapters in the Yellow Emperor's Classic. Now we got 81 questions. So it's like everybody loves this number, 81. Therefore, we call this the 81 difficulties that we have to solve. So question 1 to 22 relates to pulse diagnosis. 23 to 29 relates to channel and collaterals. Questions 30 to 47 relate to Zhang Hu. Question 48 to 61 relates to discussion of disease. Question 62 to 68 relates to acupuncture points. And out of these, 69 to 81 relates to acupuncture therapy. The entire book is really on describing the fundamental TCM. Now, there are some new concepts. There are also some contribution to concept that's already been discussed in the Yellow Emperor's Classic, but elaborate a little bit more. For example, it contributed to some of the terms, such as Minmen, Sanjiao, the 7 gates of a digestive system, we call it Qi Congmen, the 8 influential points in acupuncture that connects to Zhang, Fu, tendon, marrow, blood, bone, pulse, and Qi. 5 types of Sanghan, injury by cold. We talk about Zhongfeng, Sanghan, Siwen. We talk about 热病 and 温病. And it also had discussion on stagnancy in Zhang organ as well as dysentery. And this book has many versions later on and many elaborations. Let's look at some of the examples. The first one, question and answer 31, Sanjiao. So the question is, Sanjiao, what is it? What is its foundation and how is it created? Where does it begin? Where does it end? What is the function? And how can I have better understanding of Sanjiao? And the answer is Sanjiao is the path for food and water metabolism. It is the beginning and the end of qi. Upper jiao is the heart area above the stomach. It dominates the reception and treatment, and the treatment should be around CV17, and that's the point. The middle jiao is in the middle of the stomach, dominates over digestion and fermentation of the food and water, and the treatment should be in stomach 25. Lower jiao is above the urethra. It dominates over separation of clear from turbid, and is about excretion. And the treatment of it can be about 1 trim below the belly button. It's housed in stomach 30 point, qi cong points. Question number 36, question answer 36, Minmen. Question, all Zhang organs have one. Why does kidney have two? Is kidney special? Well, it's not that special in that sense. Kidney has two because one of them is actually not the kidney Zhang organ. The left one is kidney Zhang organ, but the right one is Minmen. Minmen houses spirit and essence and provides the foundation of source qi. In man, it is a place to store sexual essence or semen or sperm. In women, it is a place to hold pregnancy. That is why kidney Zhang organ, it's only one. So they're pretty clear at that time, even though the anatomy might be a little bit off, but it's discussing the importance of reproduction, the importance of hormone, importance of glands. Question and answer number 45, Ba Hui. Ba Hui is 8 influential points. The question is, Nei Jing made a mention of Ba Hui, 8 influential points. What are they? Well, liver 13, for example, is the meaning of the Zhang organ. Spleen Mu CV12 is the meaning of the food organ. Gallbladder 34 is the meaning of tendons and sinews. Gallbladder 39 is the meaning of marrow. And bladder 17 is the meaning of blood. Bladder 11 is the meaning of bone. And lung 9 is the meaning of the blood vessels. And stomach Mu point CV17 is the meaning of qi. If there are febrile diseases, treat these 8 points accordingly. So as you can see, this is a beginning, and there's a little bit of mistaken discussion why certain points not really correct, but later on it paved the foundation of these 8 influential points. So this is I just want to share with you some of the example of Huang Di Nei Jing as your major classic and a little bit on Nan Jing. And I hope you enjoyed the talk today. And this is a conclusion on the Huang Di Nei Jing, the medical classics doctrine. Thank you for listening.